October 16, 1846. A packed operating theater in Boston. Doctors and students crowded into stadium seating, all staring down at one man, about to attempt something almost nobody in the room actually believes will work. A young dentist steps forward, holding a glass sphere and a soaked sponge. He isn't a surgeon. He has no formal medical training. 18 months earlier, in this exact same room, a different man tried something similar and was laughed out of the building when his patient screamed in pain halfway through. Everyone remembers that failure. The dentist holds the sponge to his patient's face. The patient breathes in. Within minutes, he's completely still, completely silent, while a surgeon cuts into his neck to remove a tumor. When it's over, the patient opens his eyes and says one sentence that changes medicine forever. He felt nothing at all. Think about this. You've probably had at least one surgery in your life, or known someone who has. A wisdom tooth removed, an appendix taken out, a broken bone set and repaired. You go to sleep, someone operates, and you wake up with no memory of any of it, no pain during the procedure itself. It's so completely routine today that almost nobody walks into an operating room genuinely afraid of feeling the surgery happen. For essentially all of human history before 1846, that same experience was one of the most terrifying things a person could face. Not a mild inconvenience, not something people simply toughed out, a genuine, widely shared dread that shaped how people thought about illness itself, because sometimes the disease felt like the safer option compared to what a surgeon's knife actually meant. You're probably thinking, sure, old surgery was rough. They probably gave people alcohol or something to dull the pain. That's the assumption most people carry around without ever really examining it, and it dramatically understates just how little protection existed. Alcohol, opium, and being bitten down on a piece of leather were genuinely the best options available for most of recorded history, and none of them came close to preventing what patients actually experienced on the table. Surgery before anesthesia wasn't uncomfortable. It was one of the most agonizing events a human being could survive, assuming they survived it at all. To understand just how different surgery once was, we have to look at what actually made a surgeon good at their job in the era before anesthesia existed. Speed. Not precision first, not careful technique first. Speed above almost everything else, because every additional second a patient spent conscious on the table was another second of unbearable pain and another chance for them to die of pure shock. The most celebrated surgeons of the early 1800s were essentially judged by stopwatch, competing to remove a limb or a tumor in under a minute, sometimes in a matter of seconds, because a fast surgeon caused less suffering than a careful one. One famous Scottish surgeon of the era was renowned for amputating a leg in under 30 seconds flat, a skill that made him legendary among patients desperate for exactly that kind of brutal efficiency. Patients were typically restrained by several strong assistants, held down bodily while fully conscious, biting a piece of leather or wood to keep from screaming loud enough to be heard through the walls. Surgery happened in front of an audience, deliberately, because watching a fast, skilled operation was considered valuable medical education. Whole categories of surgery, anything involving the chest or abdomen, were essentially considered impossible, not because surgeons lacked the anatomical knowledge, but because no patient could survive being cut open slowly enough to do that kind of work while fully conscious. Attempts to solve this problem stretched back centuries before 1846, almost all of them disappointing. Opium and alcohol dulled awareness somewhat, but never came close to eliminating pain, and dosing either one heavily enough to actually help risked killing the patient outright before the surgeon even picked up a blade. Some healers experimented with pressure points, cold, or simply knocking a patient unconscious through blunt force. None of it remotely reliable. By the early 1800s, a handful of chemists and dentists had begun noticing something curious about two specific gases, nitrous oxide and ether, both of which seemed to produce a strange, giddy insensibility when inhaled. For years, this observation stayed mostly a curiosity and a party trick, demonstrated at traveling shows where audiences paid to watch volunteers stumble around laughing under the influence of what people called laughing gas, with almost nobody connecting the obvious medical potential sitting right in front of them. A dentist named Horace Wells was one of the first to make that connection seriously, and in January of 1845, he arranged a public demonstration at this same Boston hospital, attempting to extract a tooth from a volunteer patient after administering nitrous oxide. It went badly. The gas wore off too early, the patient let out an audible groan mid-procedure, and the skeptical crowd of doctors dismissed the entire idea as an embarrassing failure, laughing Wells out of the room. The setback nearly buried the concept of chemical anesthesia entirely, discouraging serious investigation for months afterward. That's where William Morton enters the story, a dentist who had actually worked alongside Wells before their partnership dissolved. Determined not to repeat Wells's public humiliation, Morton began experimenting privately with a different substance, sulfuric ether, testing it first on animals, then on himself, then successfully performing a painless tooth extraction on a patient in his own dental office in September of 1846. Word of that success reached a Boston surgeon who arranged for Morton to attempt a public demonstration at Massachusetts General Hospital, in the very same operating theater where Wells had failed disastrously less than 2 years earlier. On October 16, 1846, Morton administered his ether to a patient about to have a neck tumor removed, deliberately concealing the substance's true identity behind a made-up name, Letheon, hoping to protect a commercial patent he intended to file. The surgery proceeded in near silence. The patient remained still and unresponsive throughout, and when he woke afterward, he confirmed to the stunned audience that he had felt nothing at all. Within days, news of the demonstration spread through Boston's medical community. Within weeks, it had crossed the Atlantic. Within about a year, surgeons on multiple continents had adopted ether anesthesia, and the entire multi-century tradition of racing the clock against a screaming, conscious patient effectively ended almost overnight. The consequences reached far beyond simply making existing surgeries less painful. Once surgeons no longer needed to work at breakneck speed against a patient's consciousness and pain tolerance, entirely new categories of surgery became possible for the first time in medical history. Careful, slow operations inside the chest and abdomen, procedures that would have been physically impossible to perform on a screaming, thrashing patient, suddenly became realistic, opening the door to techniques that simply couldn't have existed under the old system, regardless of how skilled any individual surgeon might have been. Anesthesia didn't just remove pain. It fundamentally expanded what surgery was even capable of attempting. There's a smaller, messier postscript to this story worth knowing. Morton spent much of the rest of his life locked in bitter, exhausting legal battles, trying to claim exclusive credit and patent royalties for a discovery that, by most honest accounts, involved contributions from Wells, from a chemist named Charles Jackson, who had pointed Morton toward ether in the first place, and from a Georgia physician who had actually used ether surgically years earlier without ever publicizing it. The scientific breakthrough that ended centuries of surgical agony also triggered decades of petty, exhausting priority disputes among the men who claimed to have invented it, a reminder that even the most genuinely life-saving discoveries rarely arrive as clean, single-hero stories. So what if Horace Wells's demonstration in 1845 had succeeded instead of failing? Chemical anesthesia might have entered medical practice under his name over a year earlier, sparing an untold number of patients that additional stretch of fully conscious surgery, and quite possibly sparing Wells himself the personal and professional decline that followed his public humiliation, a decline that eventually ended in tragedy years later. Or the embarrassing public failure that Morton witnessed firsthand might never have existed to push him toward experimenting more carefully and privately before risking his own public demonstration, meaning ether's eventual success might have arrived even later than it actually did, delayed rather than accelerated by removing Wells's mistake from the timeline entirely. Remember the last time you went into surgery and simply woke up afterward, the entire procedure erased from your memory without a single moment of pain? For nearly all of human history before one October afternoon in Boston, that same experience meant being held down by several strong men, biting down on leather, and hoping the surgeon in front of you was fast enough to finish before the pain became genuinely unsurvivable. So next time you or someone you love goes in for a routine procedure and simply falls asleep beforehand, remember what's actually happening. You're not just avoiding discomfort. You're standing on the other side of one of medicine's most dramatic single-day turning points, made possible by a failed public humiliation, a dentist's stubborn private experiments, and one silent, motionless patient who proved, in front of a skeptical crowd, that centuries of agony had never actually been necessary. You've gone under anesthesia without a second thought. Now you know why.